Representative Deal.
Chair Knowles, I move to approve the -11 amendment dated 3/27/2023.
What was the date?
March 27th, 2023.
Vice Chair Deal. Representative Deal moves -11 amendment to House Bill 2002 dated March 27, 2023. Representative Deal, would you like to say a little bit about your amendment?
Yes, thank you. The -11 basically treats detransition treatments the same and puts them on equal footing as gender-affirming treatments. The whole idea is it requires insurance to cover and treat detransitioners with the same care and compassion that we treat gender-affirming folks. The -11 also includes a change to the malpractice insurance statute of limitations from 5 to 10 years for doctors practicing gender-affirming treatments. And it also sets up a advisory council that would develop a document outlining the risks associated with transition. And that document would be included in the informed consent process. So here's where I'm at with this thing, Chair. I mean, I know this bill is going to pass. Every legislator in this building on the Democratic side has signed on to this bill. And a major element of 2002 is mandating health insurance coverage for gender-affirming treatment. The problem is, and I've talked to lots of parents, therapists, doctors, and detransitioners. It is indisputable that some youth are being harmed in our process. We are not following adequate assessment processes, and we're catching kids in this process. And I feel for those kids and young adults. It's not just kids. So if we're going to go ahead with gender-affirming treatment without fixing any of these underlying problems or even researching these underlying problems, we're going to end up with more children and more young adults being harmed. And that's why this -11 is in place. It will require that detransitioners get the same health insurance coverage as transitioners. And I think it's the right thing to do.
Yeah. Oh,
yeah.
I'm sorry.
No, go ahead.
Finish? Okay. Anybody else have a comment? So, Representative Deal and colleagues, I believe the vast majority of people who engage in and need this kind of care as contemplated by this bill find that the process and the procedures are successful for them. There are risks in any medical procedure and medicine, including the risk of doing nothing. But the risk and assessment is best left to providers and patients and their families, and I think not us deciding here what is best for them. I certainly don't know what is best for every person. If a person in my life did not identify with the gender that they were assigned with at birth, I would want them to have access to providers with knowledge and experience of how to make an individualized plan for themselves and how to address it. These providers, I believe, first and foremost, they ask questions, they show compassion, and assess over a period of time the most appropriate care. And sometimes that might include medical interventions. Sometimes it might not. This is a bill that's ultimately about insurance coverage, not about treatment modalities and standards of care, which are already determined as medically necessary by medical professionals when they are indicated. As I've already said, House Bill 2002 is about being able to consult with a provider or physician to make a deeply personal decision that impacts your health and well-being. In the very rare cases where someone and their healthcare provider decides the best course for them is to make a revision to a previous gender-affirming treatment they received, I believe the language in House Bill 2002 with the -5 amendment already covers that, and that's on page 11, line 8 of House Bill 2002. It gives the department the ability to provide further guidance, page 11, 9 through 5 of the dash amendments in terms of rule.
Can I respond to that, Chair?
You can make a statement, sure.
I'll make a statement. So the best data that we have today, and this data changes fast because this population that's being treated is changing rapidly. We have probably 10 to 30% of people over a period of time will detransition.
I think that's very high.
Now,
that's not.
I'd be happy to share the data with you.
All right.
That is the current state of the data.
I will
now,
tell
not
you,
all
I don't
those
agree with
people,
that.
not Not all those people have had surgery, but that's the state of the data. Currently, you can get gender-affirming treatment covered by insurance, but if you face regret and you want to change, that is not covered under insurance. And I shared with you a story of a young man who faced that very situation. He got breast implants and he was castrated and immediately faced regret. And as he got clean off his meth and the drugs he was using, he went back to the hospital to have the breast implants removed, and he was denied because the Oregon Health Plan would not cover that. They would put them in, they would not take them out. He took his COVID money and found a doctor that would do this treatment for him. He could not afford full anesthesia, so he had local anesthesia on his breasts as they ripped these things out of his chest while he was conscious. That is what I'm looking at. That is not right. But that is why this -11 is here. I think he deserves that opportunity just like anybody else.
Representative Deal, this is what I would ask that you do. First of all, I don't agree with your assertion about the number of people that regret the decision they make to change their gender.
I'm happy to share the studies.
Okay, we can disagree about that. Here's what I would say about the story that you just shared from that individual. I would ask that you provide, as much as you can, the information about that circumstance, because I think some of the things that you're putting on the record, I have to say, I find them pretty incredible. The fact that a physician would seek to provide medical care to someone who needed full anesthesia and gave it with something, I'm not going to use the words used properly, something that you said was more localized, as opposed to what would be appropriate care for that procedure. I have to tell you, I find that story very incredible, if it is to be believed. I think that doctor engaged in some form of malpractice, and I would submit to you that the physician that agreed to do that surgery probably deserves to be investigated.
Well, it's interesting because I would say the doctor who inserted those,
Allowing it because he's going
that's fine.
here, so I'm going with it.
the doctor who inserted those, and 2 days later, this young man feels regret. And the fact that they were put in with insurance, and he had to pay out of his own pocket to have them removed. That is what's horrific to me.
Representative Deal, I would ask that you please provide me as much detail as you can about that, because I think that needs to be investigated. That's pretty out there.
It is an example of what,
It is an example that
even-
you've shared. Yes, okay, I'm gonna
Yeah.
say you and I don't agree about this. So if you're gonna get me to look into it, I'm gonna need a lot more information.
it's not just that case, though.
Well, okay, but it is the case that you
Do you
shared.
think that that young man should have had insurance coverage if it paid for him to put him in?
I think that
should they
that
be
child,
taken
that
out?
young man deserved a much better, more caring, compassionate physician and somebody who would have
Yes, he
provided
did.
anesthesia.
And he did not get it when he went back to the place that did.
I would like the ability to
put those in.
investigate that. That's pretty out there.
I would agree.
Any other comments on the -11? Can I get a roll call vote, please?
Rep. Bowman.
No.
Rep. Conrad.
Yes.
Rep. Dexter.
No.
Rep. Deal.
Yes.
Rep. Jabati.
Yes.
Rep. Morgan.
No.
Rep. Pham.
No.
Rep. Tran.
No.
Vice Chair Goodwin.
Yes.
Vice Chair Nelson.
No.
Chair Nos.
Chair Nos votes no. The -11 is not adopted.